Please, sir, I would like to be able to do this because this happens with Senator Rand all the time.
I don't think you're the end all.
Thank you, Senator.
Go ahead and answer
As much as I respect you, Dr. Fauci, I don't think you're the end all. I don't think you're the one person that gets to make a decision. We can listen to your advice, but there are people on the other side saying there's not going to be a surge and that we can safely open the economy, and the facts will bear this out. But if we keep kids out of school for another year, what's going to happen is the poor and underprivileged kids who don't have a parent that's able to teach them at home are not going to learn for a full year.
I have never made myself out to be the end-all and only voice in this. I'm a scientist, a physician, and a public health official. I give advice according to the best scientific evidence. There are a number of other people who come into that and give advice that are more related to the things that you spoke about the need to get the country back open again and economically. I don't give advice about economic things. I don't give advice about anything other than public health.
All I hear, Dr. Fauci, is we can't do this, we can't do that, we can't play baseball. Well, even that's not based on the science. I mean, flu season peaks in February. We don't know that COVID's going to be like the flu season. It might, but we don't know that. But we wouldn't ban school in October. You might close some schools when they get the flu. We need to not be so presumptuous that we know everything. But my question to you is, can't you give us a little bit more on schools that we can get back to school, that there's a great deal of evidence and it's actually good evidence that kids aren't transmitting this. It's rare and that kids are staying healthy and that, yes, we can open our schools.
Thank you, Senator.
Go ahead and answer please answer the question.
Yeah, so very quickly, Senator Paul, I agree with a lot of what you say about, this idea about people having to put their opinions out without data. And sometimes you have to make extrapolations because you're in a position where you need to at least give some sort of recommendation. But if you were listening, and I think you were, to my opening statement and my response to one of the questions, I feel very strongly we need to do whatever we can to get the children back to school. So I think we are in lock agreement with that. The other thing that I'd like to clarify very briefly is that when things get in the press of what I supposedly said, I didn't say. I never said we can't play a certain sport. I am completely unqualified to tell you whether you can play a sport or not. The only thing that I can do is, to the best of my ability, give you the facts and the evidence associated with what I know about this outbreak. Thank you.
Do you have any second thoughts about your mitigation recommendations, considering the evidence that despite all of the things we've done in the U.S., our death rate is essentially worse than Sweden?
I'd be happy at a different time to sit down and go over detail. You've said a lot of different things. You've compared us to Sweden, and there are a lot of differences. And you said, well, there are a lot of differences between Sweden, but compare Sweden's death rate to other comparable Scandinavian countries. It's worse. So I don't think it's appropriate to compare Sweden with us.
You've lauded New York for their policy. New York had the highest death rate in the world. How could we possibly be jumping up and down and saying, oh, Governor Cuomo did a great job? He had the worst death rate in the world.
No, you misconstrued that, Senator, and you've done that repetitively in the past. They got hit very badly. They've made some mistakes. Right now, if you look at what's going on right now, the things that are going on in New York to get their test positivity 1% or less is because they are looking at the guidelines that we have put together from the task force of the 4 or 5 things of masks, social distancing, outdoors more than indoors, avoiding crowds, and washing hands.
Or they've developed enough community immunity that they're no longer having the pandemic because they have enough immunity in New York City to actually stop.
I challenge that, Senator, because I want to, please, sir, I would like to be able to do this because this happens with Senator Rand all the time. You were not listening to what the director of the CDC said, that in New York, it's about 22%. If you believe 22% is herd immunity, I believe you're alone in that.